Good evening and welcome to all the viewers this evening. Thank you so much for joining in for this very interesting and topical program, which is translating the new nutrition guidelines to practice. Today's guest on my show is Dr. Rebecca Kuriyan. Now, who doesn't know Rebecca Kuriyan? She is very well known in the nutrition and dietetic circles as a great researcher and also a very good dietitian and a nutritionist. So if you have any questions, as usual, please post them in the chat box. Let me show my disclaimer slide to all of you before we begin. Just give me one moment, please. Okay, I hope you're able to see this. All right, there it is. The views expressed in this program are for information only. Kindly seek a physician's help if you have a medical problem, and please consult a qualified dietitian for personalized diet plans. Thank you very much. And I'm going to stop sharing now. Yeah. And we move on to introducing Rebecca. And before I introduce Rebecca, a very warm welcome to you, Rebecca. Thank you so very much for taking time out. I know how busy you are, but you took time out and you've given us an hour today. So thank you so much and a very warm welcome to you on this show.
Thank you, Sheela. It's my pleasure.
Thank you. Just to introduce very briefly, Rebecca to all of you. Actually, if I have to start introducing or talking about her, I will probably take an entire hour. So she's sent me a very brief introduction, which I'm going to read out. Dr. Rebecca Kuriyan Raj is professor and head Division of Nutrition, St. John's Research Institute in Bangalore. She completed her PhD in the field of nutrition from Avinash Lingam Deemed University, Coimbatore, and heads the Clinical Nutrition Unit of St. John's Medical College Hospital. She has over 25 years of experience in clinical nutrition, research, and academics. Her main research areas include infant, child, and adolescent health, clinical nutrition, body composition, and energy expenditure. Currently, she is looking at longitudinal measurements of body composition in infants at birth and in the early years of life. She has established a cohort of 10,000 urban school children and measured body composition in them. The findings of these studies have developed waist and body composition percentiles curves for South Indian children. I think that's a fantastic achievement, Rebecca. Rebecca and her colleagues have built a state-of-the-art whole body potassium counter for estimating body cell mass in humans with financial assistance from DBT, Government of India. And some of us from the Bangalore dietitians group had the privilege of visiting St. John's and seeing the potassium counter, and I think a couple of us even experienced the whole process, and it is a wonderful visit. And again, thank you, Rebecca and Dr. Kurpad and the entire team at SJRI for facilitating this. This facility, the only one in Asia, has the potential to address many important research issues in clinical research and public health. Dr. Kuriyan is currently collaborating with International Atomic Energy Agency for estimation of body composition in infants using stable isotopes. She is actively involved in training and mentoring students and has been the course director for a 2-week short-term course in international nutrition research methods since 2010, which is a part of the Bangalore-Boston Nutrition Collaborative between St. John's Research Institute, Harvard T. Chand School of Public Health, and the Tufts University. And I know a lot of dietitians who have attended this program and benefited a lot from it. This course has been held annually since 2010 and trained over 500 students across different countries. Rebecca has published 98 research papers and authored a book on nutrition in obesity and diabetes. She is the associate editor of European Journal of Clinical Nutrition. She is also a member of the expert committee of Department of Biotechnology and Food Safety Authority of India. Uh, Once again, a very warm welcome to you, Rebecca. That is, I mean, the amount that you have achieved is, of course, unbelievable. And thank you for being here. Shall we begin with the questions? Yeah.
Thank you once again, Sheela. Sure.
All right. So my first question to you is about the new AAR and RDA guidelines, and they have changed some practice points for dietitians. For those who may not be familiar with these terminologies, can you please explain briefly what EAR and RDA stand for and how they are applicable in practice, please?
Okay, so I think without complicating things too much and just to simplify it, I think I'll try my best to do that. I think RDA is what we have been using so far, but then this new nutrient guidelines, we heard the term EAR or the estimated average requirement, which is the average daily requirement of a nutrient for a healthy population. That's the key thing. It's for a population, and it can be used to evaluate nutrient inadequacy. And there is also another term that we are used, is also called the TUL or the tolerable upper limit. So remember that EAR is a value that has been used in this set of guidelines, and it is for population. So the RDA, on the other hand, is the recommended dietary allowance, which can be used for an individual. And so when we talk about RDA, we have to use RDA with a little bit of caution, because it is the nutrient level at which almost 97 or 98% of individuals in the population, their requirements are being met by the RDA. So this is normally derived where we simply putting it as we use the EAR as the 50th percentile used to, and then by using two standard deviations, or we arrive at the safe level or the recommended dietary allowance or the RDA. So you must remember that for individuals whom we are prescribing RDA, we need to monitor them closely, because there is a risk of actually giving them more of the nutrients. So, but in this guidelines, we are using the EAR, and I think we should stick to that. And I think that is the first thing that we must remember, that this guideline has focused on EAR. There is no R, it's EAR.
Okay, that's very interesting to know. And you have very clearly explained the difference between EAR and RDA. Thank you so much for that. Moving on to the next question, Rebecca. The energy recommendation has reduced in comparison to the old RDA. So, what foods should one reduce in order to reduce the total energy intake?
Here again, I will just, it's again repeating the same thing. There is no RDA for energy. It is the EAR for energy, because again, because excess energy is stored in the body, and so we do not have a risk of, deficiency of energies. And we must remember that for energy, we don't say EAR, but we say EER, that is the estimated energy requirement. Okay. Now, yes, the energy recommendations for EAR are lower this time, because one is it's EAR. Second is because of multiple factors. Again, I won't go into the actual theory of calculating it, but one is because it is using the factorial method in adults and elderly, and that is because earlier it was used using the Schofield's equation. So that's a Western equation that was used. And by accurately looking at studies that carefully measured BMR, it is found that Indians have about 9 to 10% lower BMR. So we know that you get the energy requirement by the multiplying BMR into physical activity level. So if BMR value is reduced by 9 to 10%, that also contributed to the lower energy requirements. And also we found that the physical activity levels, when we accurately measured in our lab among adults, we found that the physical activity level has come down. And thereby the PAL value, the physical activity level also used for this guideline was lower. It was used, 1.4 was used instead of the earlier 1.53. This is all technical, but just to tell you that it has come down, yes, for these reasons. But what do you need to do to reduce the energy intake in a diet? Of course, it is energy dense foods have to be kept. We have to keep an eye as when we say energy dense foods, foods which are a larger amount of calories or energy for the particular volume. Also, refined sugars, empty calories, and fat, of course, we have to keep an eye on. But more importantly, I think what has been getting a lot of focus is processed and ultra processed foods, which are proving to be more and more dangerous. These also have more calories. So I think
Okay.
if we reduce refined foods, simple sugars, fats, and also processed and ultra processed foods, we can control. And of course, maintaining the normal macronutrient distribution.
Yeah. Yeah, I think that's a very important point that you made, maintaining the macronutrient distribution while
I'm doing
reducing the
exercise and that, but we know what is a normal macronutrient distribution.
right, right, and while reducing the unwanted calories.
Yes.
Yeah, okay, that's great. Moving on to protein. Now, protein supplements, I'm sure you're aware of this, are being sold to healthy adults, making them believe that they don't require, they don't get adequate protein through the diet. What is your comment on this?
As long as I am surely not for supplements, and I do not, and as long as a person is getting a balanced diet with high quality proteins, I think there is no need for supplements. And again, if the protein energy ratio is between 12 to 15% of the diet, I think coming from that normal food or a diet, I think it can easily be met. And these can be met by using foods which have high good amount of biological value proteins like milk and milk products, legumes and dals, egg, and I think we can meet the requirement. Of course, in very specialized cases, we may need to give supplements, but not on a normal condition.
Okay, okay. I hope that clarifies the point on protein
And
supplements.
again, for muscle building and protein building, as we all know, and I'm sure all the dietitians also know, there's no point giving too much of protein without doing enough of exercise, especially resistance exercise.
Yeah, absolutely. I completely agree with you on that. All right. How do we balance the N6 and N3 PUFAs? Because when we see in practice, most people take more of N6 than N3. So, what would you suggest?
Yeah, I think this is a major problem in our country, and I think we exceed the range or the ratio of N6 to N3 by about 3 to 7 fold based on the dietary recall that we see. And how to practice this by including more of oils and fats that have more of better combinations of oils. So rather than taking one particular oil which has only N6, we have to use oils which have a good ratio of N6s to N3. And such sources normally are coconut oil, soya bean oil, rice bran oil, and like I said, including a little bit of ghee and including a blend of oils in our cooking in a month. I think that's what we need to prescribe to our patients, to have a combination of oil rather than one single oil in a month.
Right. But what do you say about foods like, today everyone promotes flax seeds and chia seeds and things that which are higher in ALA. So do you think that also will to some extent help in building up?
Some extent.
Yeah, to some extent it would build up the N3.
Yeah.
Okay, great.
Not sure of the real good evidence for that, but I think to some, surely it can't cause any harm, but to some
Yeah.
extent.
Okay, wonderful. All right. So now coming to calcium, the I'm talking about RDA because RDA for calcium, I think, is now set at 1000 milligrams. Am I right?
Yeah, I think.
EAR or EAR or RDA. All right. It is now set at 1000 milligrams per day versus what it was 600 milligrams earlier. So
Hmm.
what kind of foods do you think dietitians should recommend to their non-hospitalized patients? Because in hospitalized patients, supplements are given, and it's probably easy to catch up. But then, what do you think one should do in a non-hospitalized, normal, healthy adults? How do we catch up, and bring it up to 1000 milligrams?
So I think this time the requirement, again, without getting into the technical details, the requirements went up because they related it also to functional outcomes. Not just biomarkers, but functional outcomes, and thereby the requirement for calcium went up. And as we all know, I think milk and milk products, because if it can be met, because I think 100 ml of milk has about 18 milligrams of calcium. So milk and milk products, I think half a liter of milk and milk products all together. But again, it's a problem of lactose intolerance.
Yeah.
Okay. And, there are some, again, leafy vegetables controversial because oxalates are there. But I think if we again have, a combination of a good balanced diet with a variety of milk and milk products, some amount of, bean, bony fishes, some egg has some amount. I think all of these together, we can get a calcium requirement. But I think 500 ml of milk and milk products is needed. For
Okay.
those who have milk issues, I think at least yogurt or buttermilk if we can try.
Okay, that's interesting. So basically what you're saying is the intake of milk and milk products have to increase in order to get a good amount of calcium. Okay, iron has been significantly reduced for all groups, the requirement. Does this mean that we can continue to rely on non-heme iron for our daily requirements? And the reason I ask this is because a large part of Indian population eats vegetarian meals on a regular basis, and meat intake is usually a weekly or a bi-weekly phenomena. So, do you think we could do that?
So I guess if a person is vegetarian, yes, we have no other choice but to take the non-heme iron source. But I think the take-home message would be to make sure that they include adequate amount of vitamin C so that the absorption of iron from those food sources are much better. And in the end, also reduce or avoid taking inhibitors like tea, coffee, and tannins along with an iron-rich meal, because stable isotopic studies in our laboratory have clearly shown that if you take tea along with an iron-rich food, that the absorption drastically comes down. And so it's not just enhancing with vitamin C, but also avoiding the inhibitors of iron like tea, coffee, and tannin. Now, if a person is a non-vegetarian, definitely make sure that they have the heme iron because it is better absorbed. And even if the requirement is low.
Okay, all right, thank you. So hopefully we will be looking at less iron deficiency anemia problems because the requirement itself has come down, is what I'm thinking.
Hope so.
Hopefully, yeah. All right, moving on to the next question. So in the context of iron, you did say about the vitamin C. The ascorbic acid EAR has doubled from what it was to provide for losses. So how do you think we can meet the 80 milligrams of ascorbic acid through foods? Is it important to prescribe supplements, or do you think we can meet through, naturally through foods itself?
No, I don't think we need supplements because eating 2 to 3 fruits in a day, and fruits like guava, for example, 100 grams of guava gives you about 200 milligrams of vitamin C. And also, if you include fruits like oranges, sweet lime, papaya, we can, ensure that we get a vitamin C requirement. But the key thing is to make sure that they are not the fruits or the food sources that we have are not subjected to heat treatment because vitamin C gets lost by the heat. So it is fresh fruits that we can eat, and in the fruits that I listed out, we can meet our requirement.
What do you think about the Indian gooseberry?
Of course. Yeah, yeah, yeah. Rich in vitamin C.
Right. Okay. Coming, coming to zinc. Again, the requirement has been increased for both men and women, and perhaps this is one of the reason that nuts and oil seeds are now, depicted in the My Plate, which is brought out by the ICMR NIN. So, what are your thoughts on this?
So yes, nuts and oil seeds do have some good amount of zinc. But what we should also remember is that the amount that can be eaten. For example, 100 grams of nuts will give you about 3 to 5 milligrams of zinc. Now, 100 grams of nuts in a person who's trying to lose weight, do we want to prescribe that? Is something that we have to really think of. So nuts, it is not just nuts and oil seeds. I think again we have to take variety of food, Some of the other good sources of zinc we also include, I mean, we get non-vegetarian meat, shellfish. Under vegetarian, legumes such as chana, rajma also contain substantial amount of zinc actually. So it's that only nuts and oilseeds have zinc is not entirely true. I think it is including a variety of foods. Nuts and oilseeds do have, but remember, keep in mind that you cannot eat huge portions of nuts and oilseeds, especially if they have other problems. You want a person who wants to reduce weight. You must remember they are also energy dense. So the nuts and oilseeds. So, like I said, including legumes like chana, rajma, along with some nuts and oilseeds, and some amount of non-veg if they are non-vegetarians, we lentils and beans we can actually make the requirement.
Yeah. Mhm.
Whole
Okay.
grain, and then I think whole grains also have some amount
Right.
of.
Yeah. Yeah. Whole grains too. In fact, millets, I think some of the millets have are good sources of zinc too. So, meanwhile, just reminding the viewers to type in your questions in the chat box. We have just a few more questions to go, and then we'll move on to the viewers' questions. All right. Coming back to your next question, Rebecca, is there are again subtle variations in the requirement for water soluble vitamins. Folate has increased by 100 mcg for men. So, how does one meet this requirement? Would eating a lot of green leafy vegetables, and things like that, would that be sufficient to meet the folate requirement?
I think that recommended allowance of having 300 to 400 milligrams of vegetables in a day that is recommended, with a lot of it being green leafy vegetables quite often in a week, will meet the folate requirement. Along with that, other vegetables, some amount of spinach, peas, again little bit of chana, rajma, all of these. I actually did some calculations, and you can meet your requirements using these. So again, there is no need for supplement. But again, remember water soluble vitamins, no too much of cooking, not too much of throwing out the water. That is the key point. The way of cooking also matters.
Right. Yeah. Yeah. Thank you for bringing up that point on cooking.
Because
Very
we
important.
normally, in our Indian cooking, we tend to kill the vegetable and add so much of water in it that almost all the nutrients are lost.
Yeah, that's true. All right. Moving on to B12, the requirement has doubled. So, which are the foods that become significant to meet the additional need? Vegans probably will not get it, but vegetarians will probably have to depend on dairy foods, for the B12 requirements. So, how do we meet this, doubling of the B12 requirement?
So again, B12, as we know, can be got only either by milk or animal source, like exactly
Right.
like you stated. I think if we get that 500 ml of milk, we will make sure that we get our 2 micrograms of vitamin B12 for the adults, and the milk products will also have it. For vegans, I think it's fortified foods. I mean, a lot of food like fortified and also fortified alternative milk. They also, I think soya milk, almond milk, all of that is kind of fortified with B12. And I think, and breakfast cereals, I think, are
Yes.
also fortified with
Some of them. Yeah.
B vitamins. But I think a point of caution for vegan for almost all is that without supplements, I don't know, maybe people will disagree with me, but for vegans, without supplements, I'm not sure if it really you can meet your requirements.
Yeah, that's it. I think it is difficult, and especially now that the requirement has gone up.
Yeah.
So they might, vegans particularly might require supplements.
Yeah,
Yeah,
vegans in particular about vegans.
right. Yeah, I agree with you.
Yeah.
Coming to vitamin D, especially for those who don't eat fish, egg yolk, and sun-grown mushrooms. I mean, mushrooms grown under the sun are supposed to have more vitamin D than the sun mushrooms grown in shade. So, and of course, that although we live in tropical countries and things, we still see a lot of vitamin D deficiency. So, what are your thoughts on this, Rebecca?
So I think milk is fortified with vitamin D, and I think if you take about half a liter of milk, I think you get one third of your requirement. But again, it's only one third. I think besides that, adequate diet, I think that's all. Like you said, we can do adequate exposure to sunlight. In that, what they say, that optimum period of time between 11 a.m. to 3 p.m. with, is important to along. But I think milk, I know for sure, is fortified with vitamin D.
Okay, but is it all brands of milk? I'm not very sure about that.
I think so.
Okay.
And
Right. Okay, I think we'll have to check that
I
out.
need to check it, but I'm pretty sure about that. Yeah.
Okay, that's wonderful. All right. So the last question to you is: do you have any other general advice that you would like to give practicing dietitians as well as the public? Because I guess some public, the general public also would be viewing this program.
I think especially for the dietitians is don't overdo supplements unless it's really needed, unless the supplement that you prescribe has adequate evidence to say that it really works. And because otherwise, if you meet your recommended allowance of most foods and food groups, you can eat a balanced diet, meeting almost all your nutrients. I think it's a very simple message. Unless you're going to have on a very low calorie, weight reducing diet, and the diet goes below, I think 1,400, 1,300, then you may not be able to meet some of your requirements.
Yeah, right.
But
Okay,
then
great.
specific situation.
Right, right. Thank you so much for all your thoughts on various new nutrient guidelines. I'm just going to quickly run through the chat here. So, Vinny, thank you for joining in. She says, hello, good evening, Sheela and Rebecca. Shanta Kumari, thank you for joining. Good evening, madam, she says. Nilanjana Singh, so nice to see you here. Thank you, Nilanjana. She says, thanks, Sheela and Rebecca, for choosing this very relevant topic for discussion. Tanvi Chipkar, thank you for joining. Rohini ES, she has a question. What are your views on taking supplements like spirulina? Rebecca?
In particular for?
What are your views on taking supplements for spirulina, like spirulina? She hasn't said for what, but I guess for general health?
I guess for general health, it's okay. I mean, it is, there is no need, but unless in specific cases, yes.
Okay.
Yeah, I don't think there's routinely a need for taking spirulina.
Okay, all right. Rohini, I hope that answers your question because you.
I mean, that's if I knew for specifically what she meant, then it would
right.
be easier.
Yeah, perhaps if Rohini is still here, she can type out, if expand on that question, and let us know.
Or if it's for good health, I don't know. I mean, it does have nutrients for sure, but then is that really something that you can't get from your diet? Is what you'll have to decide.
Yeah, exactly. I completely right. I agree. All right. Swapna Agarwal, thank you for being here. And she asks approximately what duration of sun exposure is needed between 11 and 3?
I think about 20 to 30 minutes.
20 to 30 minutes. Yeah. Make sure you don't get
sunburned. There is something about how much of exposure. I think 10% of your body surface area, something like that. I'm not the expert on that, but I'm sure that clearly says that. I think there is how much of exposure that is. I think I had written it down there, but let me see if it's there.
Okay. Meanwhile, Gayatri says thank you. All right, you're welcome, Gayatri. Yeah, go ahead, Rebecca. You found the answer?
20 minutes, I think 20 minutes with about 10% of body surface area exposure. And I suppose if it's a rainy day or it's monsoon time, you need a little more, about 40 to 45 minutes.
Okay. So I hope that answers Swapna's question. Rohini has come back with that question about spirulina. She says for proteins. So what are your views on taking supplements like spirulina for proteins?
I'm not 100% sure of the protein. I know it has proteins, but I don't know the exact amount of protein and its biological values. So I think if you can get it from a good source dietary protein,
yeah,
take that unless you need, but maybe no.
Probably not.
Not for protein, I mean.
Yeah, exactly. I would think so too. I wouldn't prescribe it for protein because there are so many other sources for protein. Sources
we know from a diet we can get it easily.
Right. Unless something that is not available through diet is present in spirulina, I'm not sure. But anyway, if you still feel like taking it for general health,
yeah,
I guess it's okay. All right, Sharvari Gaikwad, what about vitamin D supplements, she wants to know.
If you really need it and your orthopedician thinks you need it, and you're much below your deficiency is high, I think you need it for some time, for an acute period. I think for 6 weeks or something they prescribe it.
Yeah, normally I think it's for 8 weeks.
6
Oh,
to 8
yeah,
weeks.
once a week or something like that. Yeah.
The sachet. I think there are tablets, whatever. If you need
Right.
it, I think your doctor or your orthopedician is the best one to decide
Absolutely.
for that.
Yeah, absolutely. All right. And Nilanjana has a question. If you think one is not getting enough vitamin D, do you recommend a daily supplement or a larger once a week dose? I think you just answered that question, but anyway.
Yeah, so again, I think it varies, and I think I'm not sure about the dosage of the supplement in terms of which is better in terms of daily or the weekly one. But I know people generally, normally the weekly one is given, and I think for ones who need more, it is the daily one.
Right.
Not the
What?
again.
Yeah, right. I mean, I'm not the expert either, but in my experience, what I have seen is the ones who are highly deficient are given a very big dose once a week, like 60,000 IU or something like that once a week. But those who are just borderline deficient are given more like a daily dose of 20, I think 2,000 or maybe 2,000, 1,000 over 2,000 MCG, and yeah, MCG, I think sorry, IU for per day or something like that. Again, I'm not the expert, but there's definitely a difference, but I guess the physician would know best. Um, okay, Swapna says, thank you, ma'am. Pleased to be a part of this amazing session. You're most welcome. Um, Thank you again. Okay, everybody is thanking you, Rebecca, for all the answers. Sharvari, Rohini, Shantakumari, excellent session. Thank you very much. And thanks to Rebecca, of course, she made it excellent. If there are any other questions, please type in. If not, we'll probably wait for a couple of minutes. And if there are no more questions, we'll wind up. Meanwhile, Rebecca, I just wanted to know how many patients do you see in your practice, in your clinical practice? How many patients on an average do you see with vitamin B12 and D deficiency? Do you see a lot of them?
Yes, yeah, yeah.
You
But
do?
and especially B12, a lot of vegetarians seem to be at risk, and D, I think, is
Quite
I
common.
mean, you do see a lot of patients when they coming with their reports and they come to do a DEXA because either after a fall and then they have done, so. But again, there is a controversy of the amount of vitamin D deficiency that is in a country because of the difference in the different methods and different assays. But yes, we do see vitamin D and more than vitamin B12 deficiency,
Oh,
but
okay.
B12 being more in vegetarians.
Mm, that's interesting. All right. Beena Nayak, thank you for joining. Her question is, what are your views on meal replacement for weight reduction?
I'm not very keen on meal replacement powders or meal replacement liquids or drinks for, I'd rather have good food and eat a smaller, and I would prescribe that to people to have smaller amounts, portion size, but of something that they will like rather than having a meal replacement powder or drink and feel deprived. Fall off the
Okay.
bandwagon once they stop the meal replacement.
Yeah, that's what chances are
Want
greater, I
to
guess.
use something that is sustainable in the young, but if the person really wants that acutely to lose weight, I wouldn't recommend, but I don't know if that's an option. I wouldn't recommend because I'd rather have them having smaller portion size of something they like than which can have the same energy levels than having you know meal replacement drink.
Yeah, yeah.
Just
I
put,
understand. Right,
sorry.
I understand what you're saying. But in again coming back to your practice, uh, how many of them are? I mean, again talking about weight reduction, since Beena brought that up. How many of your patients who are on a weight reduction program? How many of them are able to actually retain the lost weight for, let's say, a year or 2 years or something like that? Or do they kind of go back to, what they were earlier, or are they able to maintain? And if yes, how many of them, what percentage approximately are able to maintain the lost weight?
Yeah, so actually losing weight is very easy, as you know, and we see it there. Maintaining that weight loss is the most difficult. And I would say the highly motivated, committed ones kind of manage to keep that weight loss and continue with that, even if they don't go through further weight loss. They at least maintain that weight loss, but a lot of them, I would say, even 30 to 40% of them regain that weight if they are not disciplined about it.
Right. Yeah.
I just want
Okay.
to say one thing, Sheela, about the spirulina. Spirulina, yes, does have some amount of protein, but again, is it? Do you want to have that from normal food, or do you want to, in a daily basis, you want to have? I mean, I don't know whether the question was about a spirulina tablet or anything for having that to increase your protein.
Mm.
It does have some amount of protein.
Right. Absolutely. All right. Swapna Agarwal says daily or weekly supplementation, both are effective. I guess she's referring to the vitamin D question
Yeah, I think.
that we discussed earlier. Okay, thank you for that input, Swapna. Chaya Mishra, she wants to know your take on intermittent fasting.
Intermittent fasting, I think there is evidence to show that it does work for but again for long term I'm not sure, but for acute weight loss it surely helps. And if many people do follow, but I am not sure about the concrete evidence for long, again, maintaining that weight loss. If it was specifically for weight loss or for sugars, I don't know the question.
Well, the question doesn't specify. It just says your take on intermittent fasting. So
Yeah, but then again, my point would be is intermittent fasting for that period of time, and then overindulgence during the eating time is going to cause damage. So it's basically discipline at I think that will work much more than intermittent fasting and then having in overindulgence and during the meal time, other meal when they're eating. You have to
right.
keep an eye on the energy or the calories
Yeah,
and
absolutely.
expenditure.
Oh yeah, I'm balancing the intake and the expenditure. Absolutely, I
Reduce
think that's
portion size, I surely recommend.
okay. All right. In all meals, reducing portion size in all
If
meals
they
is what
want
you're
to
saying.
lose weight, yes.
Yeah, yeah.
Start with
Okay.
reducing 25% of what they eat. At
Mm-hmm.
all meals start off with.
Yeah. Okay, that's a very good point. I think 25% reduction in all meals
It's
to start
easy to
off with.
see in a plate, whatever you serve,
Right.
25% of it, especially the carbohydrate part of it. If you reduce
Right.
25%, not too difficult, you don't feel hungry.
Mm. Okay, wonderful. Okay, I think that's about, again, Swapna, sorry, has mentioned about vitamin D. She says recently she attended a session of S-Pen, which showed both weekly and daily supplementation are good and effective. Thank you for sharing that information. And supplementation of large doses needs to be avoided, she says. Monthly supplementation of large doses needs to be avoided. Okay, that's a lot of information on vitamin D. Thank you so much, Swapna, for sharing all that information. And I guess there are no other questions. So once again, Rebecca, thank you so much for sharing your wealth of knowledge in this program, and for sparing your time. I think, it is very,
Pleasure.
very precious, I know, and I know you're an extremely busy person. Thank you so much for being here. And I hope to see you on another platform, or maybe once again on Nutrition Nectar platform sometime later. Thank you
Sure.
again.
Thank you,
And
and thank you all for your questions. And
yeah,
I'm happy.
thank
I was
you.
happy to be joining with you all.
So
Thank you.
nice. Thank you, viewers, for being so interactive. Thank you for the questions, and thank you for your presence as well. Nutrition Nectar will be back again with more programs, so stay tuned. Meanwhile, stay safe too. Thank you, and bye-bye.
Bye. Bye.
Bye.